Hi, everyone. Welcome to this week's Biz Talk from the Greater Wilmington Business Journal. I'm Vicki Janowski, editor of the Business Journal, and today we're discussing the upcoming COVID-19 vaccines that could be opening up to children ages 5 to 11. Joining us today on our panel is Dr. Paul Kamitska. He's the chief epidemiologist for New Hanover Regional Medical Center and also an infectious disease physician with Wilmington Health. Also joining us is David Howard. He is New Hanover County Health Director. And so we're going to be going over the upcoming plan for the vaccine rollout if it gets federal approval, as well as some questions that have been coming up from parents and members of the public to them. So if you want to also ask questions for our guests today, feel free to put it in the chat in our Facebook feed that's live right now on the Business Journal page, and I'll keep an eye on that to pass some of those along. In the meantime, let's hear a quick word from our sponsors, Cape Fear Realtors.
Hello, I'm Ann Gardner, CEO of Cape Fear Realtors. Realtors support this program's efforts to connect our community in meaningful dialogue with actionable insights. Realtors are dedicated professionals who build strong, resilient communities and businesses. Work with someone you can trust. Work with a realtor. Learn more at capefear.realtor.
On Tuesday, an independent panel recommended using the Pfizer vaccine for COVID-19 on a younger set of children that had been open for eligibility already. And those are children ages 5 to 11. The vaccine already has been approved for teenagers ages 12 and up, and that has been rolled out for several weeks now. Now it goes through another process, though, before approvals can happen for these younger sets of children. So to talk to us a little bit about what happens next and some of the questions that are coming in for parents around the childhood vaccine, we have David Howard with the county and Dr. Kamitska with the hospital and Wilmington Health. So just to kick us off, I mentioned that the FDA panel recommended use of the Pfizer vaccine in a lower dose for children. So David, could you kind of explain and walk us through what happens next?
So those approvals are the same as the approvals that went for the original vaccine, FDA, CDC. CDC adds some detail as to the guidance to providers. So we're a provider. Every doctor's office who is receiving a vaccine is a provider. The 5 to 11 age group is a different age group. So the vaccine is the same product, but the dosage is different. So it's packaged and shipped differently. That shipping supply is already in action. The manufacturer, Pfizer, is ready to go, as it were. So beginning as early as next week, that initial shipment will go out to providers in North Carolina and probably likely in most states. The priority is to get some in the hands of every single county. So a lot of the supply is going to local health departments, but also other providers, federally qualified health centers, rural health centers, and then also very quickly, within a couple of days, larger health centers will be receiving their supply as well. So in terms of local distribution, we're going to be offering that vaccine to children and their parents, their caregivers, guardians. In our normal clinics, we'll probably be setting up some more privacy and considerations for children 5 to 11. That's a different age group. You have to take that into consideration in terms of making them comfortable. Also, we're looking at two major components that we've always looked at: making sure it's accessible in a feasible way to the entire community. Those families with parents who work a lot of jobs and those kinds of issues, it's not easy for them to get to a place. And also we're talking to the schools. There may be opportunities to work with them to go into in particular schools to make it as easy as possible for parents and guardians to get their children in.
And so it sounds like it still does need to go through FDA and CDC approval process, but that states and local areas are already starting to plan for distribution pretty soon.
That's correct. Similar to back in December, everything was all lined up and ready to go and get the product to the public as soon as all those approvals and all those specific guidances are in place. And then on the state level, what happens is the state health director, Dr. Tilson, formulates that standing order that public health operates under. And also all the providers look to that as guidance as well. Physicians have their ability to administer under their license, but the standing orders from our state health directors is what public health operates under.
And Dr. Kamitska, why don't you take us through a little bit how we got to this point? I know when the Delta variant started really kicking up in earnest, a lot of parents who were waiting for a vaccine for younger children had a lot of questions about why was it taking so long for the approval and clinical trial process for this age group.
Yeah. So, I think what happened is that initially the vaccine was studied in adults, and it was important to get the vaccine out early, particularly to elderly adults who were most impacted by the virus. And since kids, at least with last year's variant, were seemingly less affected, and certainly less affected from the standpoint of view of hospitalization and mortality, those studies were delayed. Now with the onset of Delta, which is significantly more contagious than last year's virus, it turns out all age groups, including children, are vulnerable to get COVID-19. And so thankfully, we now have some data with the Pfizer product. That was a study of about 2,200 or so in the study, and showing about a 91% protective efficacy, which is similar to the protective efficacy that we've seen in older age groups. And in terms of potential side effects, the one side effect that we want to pay particular attention to, although it's still very, very rare, is the effect on the heart, the myocarditis. The cases that we've seen so far have been particularly in young men, late adolescent, early, like in the 20s, and the vast majority have been mild. And one should also remember that you're far more likely to get that particular problem if you get COVID as opposed to getting the vaccine. In the trial in the 5 to 11-year-olds, that was not seen, although the numbers again were 2,200 as opposed to the millions and millions of doses we've given to older age groups. And the dose of this vaccine, I think, as David was alluding to, is really 1/3 that we give to older folks. So hopefully with the dose reduction and the data we have so far suggesting very good efficacy and very good safety, I think that's what led to the FDA panel recommending that we approve this.
And have you seen any other studies, even if it's other parts of the world, in terms of, well, I'm sorry, not other types of world, but besides the Pfizer submitted data, either on the efficacy or even on the short-term potential side effects?
Yeah, so other parts of the world, like Israel, is a few weeks ahead of us, generally in terms of the use, and they use the Pfizer vaccine broadly in the population. And basically, there really are no significant safety signals. One of the things that people talk to me about often is the concern that there may be some lurking, unforeseen, downstream adverse effect of these vaccines. And really, in the history of vaccines, in the total history of vaccines, there never has been something like that wasn't already known about within 6 weeks of initial release of a vaccine. And now we have millions and millions and millions of doses. There really has not been any other pharmaceutical product that's been vetted as closely for safety as these vaccines. And we just don't see a signal. And so that everything in medicine is a risk-benefit calculation. And the benefit of getting vaccinated so far outweighs the risk that it becomes just the right thing to do.
And David, similar, what are your thoughts? Or, I mean, I know you are not directly seeing patients, but that seems to be one of the more common questions that comes up with families in terms of there's no way to know long-term impacts. And in terms of like polls that have been done and hesitancy of those who have said that they are hesitant about vaccinating their children, that comes up a lot in terms of there's no way to know any, like Dr. Kamitsa was saying, downstream effects. How do you plan to answer questions from families in the community when that comes up, when the doses are being circulated?
So from a public health epidemiological standpoint, and Dr. Kamitsa may have a comment on this as well, we also have the conversation about when are we considering COVID-19 endemic? In other words, with us forever across the community, and not something that is necessarily something we're going to stop at some point. And what that means is eventually it's very difficult, if not impossible, to avoid either getting vaccinated and catching the original SARS-CoV-2 or one of these variants and contracting one of those, or not getting vaccinated and contracting it. In other words, very difficult to avoid this virus. It spreads very well, especially the Delta variant. And so from that standpoint, getting the vaccination just gives you a preparation to deal with the virus much better when you catch it, not if. The other standpoint is especially the mRNA vaccines. I'm not a physician, but the reading I've done is around that's the technology has been researched for a long time. The use of that messenger RNA technology is very effective because it is just that. It's a communication system that we have discovered, medical science has discovered, and is using to our advantage to deliver a message to our immune system and preparing it to respond not only robustly, but very quickly. As soon as the virus enters our system, as opposed to having to wait a couple of days for our system to build up antibodies. And sometimes that day or two makes a big difference. It takes people down into a serious illness faster and for a longer period of time, which impacts the healthcare system. So from our standpoint, the safety is there. As Dr. Kamitsa mentioned, it's literally hundreds and hundreds of millions of doses have been given. Over working on a year now, actually, since January, and in Israel's case, a little sooner, right? And so we have not only now good numbers data, we have a pretty good longevity, and we would expect to see serious complications if they're going to arise, very rare complications. And mostly, as Dr. Kamitsa mentioned, the complications from becoming ill from contracting the original virus or one of the variants are much more severe than anything that might come from the vaccine. A day or two of uncomfortable aches and pains is not that serious. So that's our message. And the other message is to very carefully consume your information about a vaccine, about the virus. Be concerned at least as much about the virus as you may be about the vaccine. That's our message as well.
And how about the issue of booster shots? Have you seen, are there plans to or is there a need for that to be available for the teens who had already received the vaccination? And is there been any discussion yet about whether younger children will end up needing boosters as well?
Possibly, but the data is pending on that. That will continue in the process of clinical research. Let Dr. Kamitsa comment on that if he knows a bit more.
Yeah, I think right now the boosters are approved for down to the age of 18 if you have a medical condition that puts you at increased risk if you happen to get COVID, or if you're in a work situation or a living situation where you have increased exposure. So I don't anticipate in the short term that would extend to younger kids, at least for now. And I think part of the caution, again, FDA has been cautious about this, is just wanting to make sure about the myocarditis, as rare as it is. We want to make sure that the benefit always far exceeds the risk. And so, but I think right now for anybody over 65 or those 18 to 64 in that risk group, I would encourage people to get their booster shot. I think many of us think that the mRNA vaccines, the Pfizer and Moderna, they were released as 2-shot series, but probably really are 3-shot series, just like other vaccines, like the hepatitis B vaccine is a 3-shot series. And one of the hopes is that in addition to boosting our current immunity levels, antibody levels, that the 3rd shot will help to educate our so-called memory B cells. Memory B cells are cells in our immune system, which if one is re-challenged with a virus, it remembers that and can quickly boost the new production of antibodies. And if in fact that is a robust response to the 3rd shot, then that would suggest that we won't need to keep boosting in the future. That the immune system will remember, just like it does for other viruses. So only time will tell. But I think the key thing, even more important than boosters, is to try to make sure that everybody who hasn't been vaccinated yet get vaccinated as soon as possible.
We should point out that the Pfizer vaccine that's planned for children of that 5 to 11 age group, even though it's a lower dosage amount, would still be the 2 shots, 3
Yes.
weeks apart, correct?
Right.
And then one question I'm sure is going to come up from patients to the providers, but I'm curious if there's guidance on if your child has had COVID recently, particularly in recent weeks with Delta circulating. Do you plan around a time frame of waiting longer before getting the vaccination? Does getting it too soon impact its effectiveness if you have had the virus recently?
So if you've had COVID, you probably do have a level of immunity, we say up to 3 months afterwards. But this is one of the infections where the vaccine actually seems to elicit more protection than having the virus itself. And in older populations, in adult populations, for example, there was a study out of the state of Kentucky where they looked at people who had COVID last fall. And then they looked at who got reinfected with COVID this past spring. And it turns out that for those who had COVID, if they did not subsequently get vaccinated, that they were 2.3 times more likely to get reinfected with COVID this past spring. And so, we still encourage all of our patients who have had COVID to go on ahead and get vaccinated. And I usually tell patients you've got up to 3 months to do that. And so that sometime in that time frame, go on ahead and get vaccinated. There's no problem with getting vaccinated early after. In fact, the guideline is so long as you're no longer contagious from your COVID episode, you can go on ahead and get vaccinated. But I usually, tell patients, sometime over the next 3 months, be sure you get your vaccine.
And David, you mentioned earlier about the possibility of having vaccinations available through the school system. I know that has caused some discussion in other parts of the country as well, as people are talking about how to roll this out. Does that have to be approved locally, or what would be the plan here for if that's a route you guys want to go?
Right, that's really just about our coordination that we've had for many, many years, really, because we employ all our school nurses who serve in all of our public school system schools. It's really just a conversation around what's best. School system does not want to interrupt instructional time unless absolutely necessary. We did that earlier on, but also kids were not in school. They were all remote, that kind of thing. So it's really just a conversation about accessibility. Making sure every parent, every household with children who is interested in receiving the vaccine for their child 5 to 11 has reasonable access to receive the vaccine for those children. And so if that is on a school property, in coordination with the school population, with the staff, the parents, the children, the PTAs, what have you, that's what we'll be looking at going forward to make sure people have options.
Okay, and we're also heading into flu season, and providers have started advocating for their patients to get their annual flu shots. So is there any reasoning for or against about getting children their flu shot and a COVID vaccine shot at the same time, or separating it out?
No, I think all the data suggests they can have it at the same time. They can get the flu shot sort of regardless of when they get the COVID shot. And so if it's simultaneously, that, you know, you get two for one. It probably is simplest that way, but it can be given without regard in that respect.
Is there any way to, I guess, prepare for or kind of safeguard against, you know, a lot of adults who have got vaccines, a lot of times you'll swap stories about how that second one took you down or what you felt like the next day, if it really had the response that it is meant to have, and you felt the effects. I'm sure that that's going to weigh on the minds of parents as well of, you know, how their kids are going to feel, particularly after the second dose shot. What do you plan to tell families on that?
Well, you know, I remind people that if you have side effects, and most of the side effects are mild, you know, you maybe have a little soreness of the arm, you may feel a little fluish for a few hours or a day or two, but that's just a reassurance that in fact your immune system is working. It is responding to the vaccine. So I tell people I'm glad when I have some side effects to a vaccine like this, because it's reassuring. I share with him, my brother, when he got his second Pfizer shot, he didn't feel a thing. And so he called in a panic because he thought he had gotten a dud. But it turns out, in fact, no, it's not a dud. Even if you don't have side effects, the data shows that your immune system is responding. So, and I would also remind people, you know, those of us who take care of patients with COVID day after day, those side effects from vaccines pale in comparison to what happens to people when they actually get COVID disease. And so, a little Tylenol for side effects, and just taking it easy. In most cases, it's going to be nothing. The child is just going to go back out and play. But there may be some, usually very minor side effects, just to be prepared for. But that's not necessarily a bad thing. It just means that their immune system is responding well to the vaccine.
Yeah.
Okay, and looking ahead, so presumably in a couple of weeks, a vaccine for COVID-19 will likely be available for anyone who wants it, or any families that want it, for people age 5 and older. So what is the latest that either or both of you have heard in terms of a timeline for those children who are under the age of 5, the final segment of the population?
I'll just jump in and say I've not heard any specific timeline, but I think that's going to follow on the continuum of the research. As Dr. Kmitza said, the FDA is conservative and constantly weighing the benefit versus the cost, and that'll have to come in due time, but only after appropriate research is conducted.
Yeah, and I know both Pfizer and Moderna are working on this down to the age of 6 months. And so those studies are ongoing. The second sort of phase of this was the 5 to 11, and now the younger population is being looked at as well. So again, I can't predict a specific timeline. It all depends on how the data comes in and how enrollment goes for those studies.
Okay, and before we run out of time, David, I did want to talk to you a little bit about the county's, New Hanover County's indoor face covering policy that's in place for all public indoor places, which is something that the Health and Human Services Board approved before. Now, knowing that you don't speak for the board itself, what can you tell us about the meeting that's scheduled coming up to look at that, that policy, that rule?
Right. So the date for the meeting is November 12th. That was set by the board at their last meeting, mostly around to give them time to look at the metrics, but also a practical matter of getting everyone scheduled, because that is not their normal monthly scheduled meeting time. It's a special meeting to look at the rules specifically. I can say that the metrics today are excellent. New Hanover County is at 4% positivity rate from community testing, which is great. Also, the rates for the surrounding counties, while they're not as low as ours, are coming down as well. And at least around 24, 25 of my last count, just before we came on, counties across the state are also under 5%, which is an encouraging sign that the improvement is broad-based. So the process is the same as when we enacted the rule, right? The board is empowered to provide these protective rules for the community, but the statute requires them to post for a minimum of 10 calendar days the rule, the content of the rule, and the intent to look at action on a rule. In this case, it would be the action would be a repeal. So that's the process. The meeting is at 8 o'clock on the 12th. Here at HHS, and they'll discuss the metrics, which currently are looking very good, barring any major changes between now and then.
And when we talked on an earlier Biz Talk, when the Delta variant first started making an appearance locally, you kind of described it from what we were seeing in other parts of the world as a very kind of fast moving variant and moves through a community, and that was your hope that it would do that. So here, do you feel like, knock on wood, that that's the stage we're at now, that it's peaked and gone through a decline here?
Well, knock on wood. I don't know what Dr. Kamiska's feeling is, but given we've been at this for a year and a half, almost 2 years, in terms of the transmission of this virus and all the variants, the majority of the population has either been vaccinated and contracted this virus and maybe not even known it, or has not been vaccinated, contracted the virus or a variant, worked through it, and maybe then got vaccinated. We don't know for sure what percentage of the population has avoided the virus or one of its variants completely. I venture to say it can't be too high at this point. Our major concern for the past 6 months really has been around these variants. A variant of a virus is playing the lottery every time it enters someone's system, and that replication process is not perfect every time. So the virus ends up creating a variant of itself just by random chance, which could be more dangerous. So we're keeping our eye on that. CDC, World Health Organization, is keeping an eye on that globally. And we're keeping an eye on that because any variants will eventually get to our shores, especially now that we're pretty much open back up. And we have to manage that. And it's always really been, from a public health standpoint, about controlling the spread, the transmission, the rate, the speed, and the impact on people's health, community health, healthcare system, and all of that. If we're not able to control to some degree, things would get really overloaded and overwhelmed, and then bigger problems start to arise.
On variants, you mentioned before what's being called the Delta Plus variant, which is being seen in the UK right now. So what are you keeping an eye on that, or what are you hearing on that for either one of you?
We're still looking at what the data may show. Epidemiological data, which is basically population data. Is it transmitting any faster? I've heard numbers that it might be slightly more transmissible, but those variants are on those spike proteins on the virus, is what we're being told. And but there again, we're in a bit different situation as we were back in the spring when Delta was spreading and then finally arrived on our shores. In terms of higher percentage of people vaccinated, the percentages of people at 18 and over adults vaccinated across the country is pretty strong. We're approaching 65, 70% in many counties and states across the country, which is pretty good. Add that to the people who have contracted and been through the virus, and hopefully considering getting vaccinated also, as Dr. Kamiska mentioned, it's a good idea to do that, even if you've had the virus. This is not something that gives you lifetime protection after you've had the virus in your system. We know that. So we're watching that, less concerned about that than we were about Delta. Delta I liken to a very fast burning brush fire. It just was transmitting so fast and so easily. That was causing as much problem, even with the 50, 60% vaccination rate, as we had back in December, January, with that other big spike we had in cases and in hospitalizations, with a virus version that was 3 times less transmissible. So that was indicative of just how transmissible and how fast Delta was moving through the population.
I think one of the things that we have to remember is because we have a more transmissible variant now with Delta, and the Delta Plus, really it's a family of variants because the virus just keeps mutating and new variants will arise, is that because we have a more transmissible virus, we need more of the population vaccinated. Remember the concept we talked about early in the pandemic about herd immunity. We were thinking maybe 60–80% of the population would need to be immune by vaccination or otherwise to halt spread. I think the more contagious the virus is, the higher that rate must be. I'm thinking more in terms of 90%, 85–90% would need to have some immunity. And in very contagious viruses like measles, that has to be more like 95%. And so I think and this also speaks to mask mandates because the virus is much more contagious. And so in any indoor setting, whether it's a supermarket or a restaurant, I'm reluctant to go in without a mask. My daughter recently was in New York City. She has been vaccinated, and she went into a bar with a friend, and the bar was checking to make sure everybody was vaccinated. And even then, she unfortunately contracted COVID. It's that contagious. And so, until we have much more of the population vaccinated, I think we still have to be very careful about masking as an added layer of protection. The vaccine is one layer of protection, masks is another layer of protection. And we need both, particularly as these variants continue to circulate.
Well, I hope she is feeling okay, Dr. Kamitska.
She's doing fine. She's back home. Yeah.
And I want to thank both of you for sharing an update with us. I do want to end on a high note, and maybe something to look forward to, and not such the stuff we always talk with you about, which is less than cheerful updates. But it's Halloween, and we'll have festivities going on around town and trick-or-treating. I think Dr. Kamitska, I've asked you every holiday for the past year and a half now, what would Dr. Kamitska do in this scenario? So what do you think? What are your thoughts on trick-or-treating and Halloween? What would be your guidance there?
I would tell kids to be sure to wear very scary masks and to do a good job of getting as much candy as they can. I mean, Halloween trick-or-treating is an outdoor activity. They're going to be masked because they're costumes sort of anyway, but that should be safe because it really is more distanced and it's outdoors. So I would tell them to have a great time.
Okay, there you heard it. And to all of our child readers of the Business Journal, you are welcome to pass on Dr. Kamitska's advice to your parents. And the expert said that you are good to go out and get as much candy as possible this weekend. Yep. So thank you again for your information, and thanks to everybody who watched and tuned in. If you want to catch up on previous Biz Talk issues and discussions, you can go to WilmingtonBizTalk.com, or you can check us out on your favorite podcast streaming platform. We'll have a update on this conversation and the video in our 4 o'clock afternoon newsletter today. And we will be back again next week with another community discussion on Wilmington Biz Talk. Thank you, everybody.
Thank you.